You may have forgotten what life was like just 1 year ago. Packed tubes, busy pubs, bustling high streets. Human contact was an indispensable fact of life, until it wasn't.
The coronavirus is the biggest threat this country has faced for decades. We will immediately close all shops selling non-essential goods. The way ahead is hard, and therefore I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives.
Mass-scale lockdowns were near unprecedented in the fight against pandemics in human history. Yet the world near universally took up this strategy in just a matter of weeks. It didn't matter if you lived in a Western democracy or in a communist dictatorship. Countries swiftly shut down their entire societies. So how and why did the world lock down? And could it happen again? In December 2019, in the Chinese city of Wuhan, doctors were finding strange cases of patients rushing to hospital with an untreatable disease causing pneumonia-like symptoms. It was slowly becoming clear a new virus had emerged, though some doctors were censored by the authorities for alerting their colleagues about the novel disease. Eventually, SARS-CoV-2, also known as COVID-19, was reported to the WHO in early January.
Yes, this is a new coronavirus.
Nevertheless, millions of people were allowed to travel around China in preparation for the Lunar New Year, and life carried on almost as normal. But then suddenly, on the 23rd of January, Wuhan, a city of 11 million people, was placed under strict quarantine. No one was allowed in or out. All public transport and private cars were banned, and schools and businesses were closed. People were even welded into buildings.
The important thing to know is that China locked down twice, really. And the first lockdown, very strangely, was actually a lockdown on what was going on. They stopped telling people. They suppressed the truth and they issued lies. They silenced the doctors who knew what was happening, including, most importantly, the whole issue of person-to-person infection. When the real lockdown took place on the 23rd of January, it was already too late. The virus had been spreading unchecked for at least a fortnight, and numbers of infections were enormous, but they denied there were any.
As January unfolded, it became clear that there was a serious, significant problem in China, particularly Hubei province and Wuhan. But it was also becoming more obvious that the virus had spread to other parts, other provinces, other cities. And therefore, it didn't surprise too many of us that the Chinese government were looking to try and control the outbreak locally.
So why did China choose to lock down its cities in the first place? History has shown that localised quarantines have been used as a policy to fight outbreaks almost since pandemics began. However, in the modern age of globalisation, cheap travel and international trade, would it ever be possible to prevent extremely contagious diseases from spreading? This was to be tested in 2003, when China was hit by another coronavirus called SARS. The initial response to the pandemic was disastrous. The Chinese Communist Party attempted to downplay the disease until a whistleblower exposed the reality of what was going on in Chinese hospitals. The government eventually sealed off entire villages, quarantined apartment blocks, and placed hundreds of thousands of people into isolation. The pandemic was eventually brought under control, and in the end, just 349 people were reported to have died in the country.
Clearly, in both pandemics, lockdowns and quarantines were not imposed until the virus had begun to spread. But the major difference is that COVID-19 was incredibly much more infectious and spread very rapidly. So the decision to lock down was taken at a point when it was clear that they were dealing with something very different, but they should have known that because lots of work had been done on coronaviruses after SARS, and they knew very well that certain variant versions of those viruses were incredibly infectious too. So for some reason, there's this long period of delay, incomprehensible delay, and by the time the world finds out what's really going on, it can't be stopped. That is why we're sitting in lockdown now.
Despite locking down too late, was the Chinese shutdown eventually successful?
I think if we look at what's happened in China, it's true to say that they've managed to subsequently control it very effectively by mass testing and then lockdowns or exclusions or prohibitions, for want of a better word, to try and control the virus. And that's been very effective. Whether or not they realised soon enough the extent of the problem in Wuhan and Hubei is very debatable, and I think we'd probably suggest that it wasn't really fully appreciated, and that's what allowed the virus to spread quite widely through China and, of course, onto the rest of the world as well.
In the West, people had little idea a virus thousands of miles away was already spreading amongst them. But it wasn't just the spread of the virus the public were unaware of. Lockdown was about to jump from east to west. Let's try this one. Excuse me, hi, I want to ask about coronavirus. Are you worried about coronavirus?
No, not at all. I think the government have got it in hand and I'm quite happy with the way they're dealing with it.
No, not really. I'm not worried about coronavirus. Yes. Not really, no. I went to Japan last week. Come through the airports. I thought there'd be more checks, but there wasn't more checks. So
were there any checks?
No checks at all.
No, not really. No, we're keeping our hands clean. No, we're not. No, we're carrying on fine.
Not really, no.
No.
Not at all? Nothing?
Nothing, no.
No.
Not at all?
No.
No.
No way.
No one's worried. During the early days of the pandemic, the virus was spreading around the world, with governments taking wildly different approaches to contain outbreaks. Almost exactly 1 month after Wuhan went into lockdown, Europe began to act decisively. On the 22nd of February 2020, the Italian government restricted travel in several northern regions of the country where the virus was spreading quickly. Soon after this, the entire nation was in lockdown. Images of patients being treated in hospital corridors and of local cemeteries being overwhelmed with bodies spread around the globe.
When you look at the number of cases that they were seeing in northern Italy, and in particular the number of hospital admissions and people who were dying, it was clear that they had a problem. By the time they realised that they got a problem, there'd been huge amounts of virus circulating in the community. That had caused significant numbers of serious illness, and that's what overwhelmed the hospitals, in particular in those northern parts of Italy. And so it was unsurprising that they had to do very similar or introduce similar measures to try and bring that virus under control. It is the only weapon we have, or one of the most effective weapons that we have in the absence of biological controls such as vaccines.
Meanwhile, back in Britain, the scale of the problem was yet to be known.
We've had similar outbreaks, haven't we, with things like SARS and MERS, and none of them had really swept the Western world in the way COVID obviously has done. And I think at first it's fair to say that we probably thought that might be an Asian problem. We didn't originally anticipate or realise the huge problem that was lying on the horizon for Britain and the whole world. At the beginning of the crisis, when he was talking about the importance of washing his hands, which was the original key public health message, he still went to that hospital visit and shook people's hands, even though you were sort of meant to be socially distancing and being careful of contact. But that's because it was obviously so ingrained in him that would be a polite thing to do.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know.
But the virus was far closer to home than anyone realised.
So that built up during January, that feeling that this was going to be significant. I'd had several conversations with colleagues who'd said, this one looks as though it might be significant, and those conversations just developed throughout January. By the time it came to February, we already had 2 cases in the UK, and then what was happening on the cruise ships outside of China, I think that became very clear at that point that the United Kingdom was going to have an epidemic.
Boris Johnson and his advisors were furiously debating what to do.
We've got quite used to the idea of lockdown now. The state has done things in this pandemic that you would never expect it to have done. So obviously it was a difficult decision and the most serious one Boris has ever taken, and one that he felt incredibly conflicted by. I remember sitting in a number 10 briefing room, and it was one of the first coronavirus briefings, and they had drawn up that first document which contained their proposals of what lockdown might look like. And they were really, really drastic and very shocking.
Lockdowns, or as we were calling them at the time, non-pharmaceutical interventions, or NPIs, are things which have never been used before at a national scale in the way that they have been in this epidemic. There was a preparedness government plan of what would happen in the event of an epidemic, and it did not include the kind of NPIs, the kind of interventions that were eventually used. In terms of scientific advice, as I say, we can't, because we didn't have any scientific basis for lockdowns, essentially it becomes a policy decision.
If lockdowns weren't part of the government's pandemic plans, the crucial question becomes, why did Boris Johnson change tack?
The thinking in Downing Street and among officials was, you have this sort of peak heading towards us. And at the time it was February, March. And what you wanted to do was push the peak back. And the thinking behind that is that you wouldn't get the double whammy of the winter crisis, which we have every year with the NHS, and the COVID crisis. And it was only later on, when new modelling by Ferguson and his colleagues at Imperial College laid bare just how many people would die if that happened, that they started, I think, to change their ideas, and then we went into a strict lockdown straight away after that.
From this evening, I must give the British people a very simple instruction. You must stay at home.
As soon as lockdowns were introduced, a new voice emerged in the national debate about coronavirus. Today, we call them lockdown skeptics.
Lockdown skeptics.
Lockdown skeptics.
The assault on liberty and livelihoods.
One of the first was the journalist and author Peter Hitchens.
I'm very lucky to have grown up in a free country. So when I saw the government reaching for tools which seemed to me to be very, very crude tools indeed for dealing with the problem, I was immediately suspicious and instinctively felt that there was a threat to freedom in general. I didn't know how right I was going to be.
But there was one country in Europe who refused to lock down. From the very start of the pandemic, Sweden refused to follow the policies of its European neighbours. Instead of forcibly shutting down shops, restaurants and bars, Sweden allowed people to take their own risks. There was no mask mandate and only limited measures were put in place. For example, restricting public gatherings of more than 50 people, and eventually placing a curfew on the sale of alcohol. In the first wave of the pandemic, the nation saw around half of its deaths in care homes, and Sweden has seen more deaths per capita compared to its Scandinavian neighbours. However, Swedish hospitals were never overwhelmed, and the country has fewer deaths than the UK, when population sizes are taken into account. The idea was people would be trusted to protect themselves and others, and to make decisions about their own dangers.
Sweden was not the perfect approach. And those of us who've argued that Sweden's approach is worth looking at are not saying, well, Sweden did everything right. On the contrary, Sweden made as big a mess of its care homes as the United Kingdom did. No one would offer that as an example of how to do it well. It's more in the case of what Sweden did not do in terms of enforced shutting down and strangulation of society and the economy. And the simple fact that having not done that, it didn't then suffer the sort of catastrophe which some of the modelers claimed ought to follow from that.
Not everyone agrees Sweden did the right thing.
I think you have to look at more appropriate benchmarks. So if you look at other countries surrounding Sweden, other Scandinavian countries, Nordic countries, what you will see is that they had far less of an impact and far fewer cases per capita than Sweden experienced. And I think often what people are using is the kind of economic argument that having lockdown is damaging for the wider economy. If you look at those places that have dealt with coronavirus with almost zero tolerance, and in fact, you could say zero tolerance, places like South Korea, China, yes, they have different cultures, that they have different ways of doing things, but these are countries that have effectively got on top of the coronavirus outbreak, and their economies haven't suffered.
Back in Britain, government advisors decided the Swedish approach wouldn't work in the UK. But why?
So that untangling of different policy decisions, different actions that was taken and what impacts they had, both on the virus, but also on people in a wider sort of health and otherwise, directly and indirectly, is something that we are going to learn about. So what happened in Sweden is going to make a different contrasting story with what happened here, with what happened in New Zealand. Several people have said to me, and I think there is some truth in this, that actually, although countries took different decisions at different times, we will largely end up having had a similar experience or end up in a very similar position. I think it's too early to say, oh yes, this country did it right, that country did it wrong. I think clearly different places have had different experiences to date, but we aren't at the end.
Despite the Swedish exception, by the 3rd of April 2020, 3.9 billion people around the world were under a form of lockdown. In the UK, as the first wave of deaths began to ease, so did most lockdown restrictions, and people enjoyed a relatively normal summer. This would all come to an end in the winter months.
When we came out of that first wave, we almost totally relaxed over the summer. And I think some of the narrative from many politicians was that we'd actually got this virus licked, that, we'd seen the worst of the storm. And yet almost all the virologists that I spoke to, we all felt that, the chances of a more significant second wave were incredibly high. And I think, that's how it's panned out. As we came into the autumn and winter months, we then saw the virus start to really gather pace.
It will perhaps take years to analyse the true benefits and costs of lockdowns, but are they here to stay? Mutated strains of coronavirus and even new viruses themselves mean global pandemics will always be a threat.
Clearly, having done it once, there is now a policy option for governments to decide to do what we've been doing for the past year. And one of the major tasks for the modelers and indeed a lot of other researchers will be to try and unpick the effect an implication of these lockdowns that we've had in the United Kingdom and elsewhere. I mean, we're not the only country going through this, and so we will learn a lot from other countries that didn't do different things.
Well, I think we have to be realistic and say that we will have future pandemics. I think that's unquestionable. And then the question is whether or not we will be able to cope with those outbreaks better than we have done with this current pandemic. And I think that will all come out in the wash. There will undoubtedly be lots of evidence sifted, and we will start to decide which decisions were correct and which decisions were wrong.
Some people are concerned lockdowns will become the natural policy response from politicians when facing a new outbreak.
I'm very concerned about it. I think it was a mistake, but if it's not challenged now, and if there isn't a firm conclusion that it was a mistake, then it is a tool that it seems to me governments will use again. I think the most extraordinary restraints have been taken off governments. Governments now feel both free to attack the liberty of the subject in a way never previously done, to impose a conformism of thought which is repellent to me, and to be unbothered by the existence of such a conformism of thought. Not just governments either. People in the media seem to be prepared to accept a conformism, an absence of dissent, and indeed a hostility towards dissent, such as I've never previously seen in my life.
The COVID-19 pandemic has meant the most significant change to daily life in Britain since 1945. The crucial question now is this experiment a one-off event, or is it time to get used to being locked down?